Hello everyone. As Diane already said, my name is Catherine Bush, and today I will be doing my presentation of my thesis, which was the analysis of new rehabilitation interventions for elderly stroke victims with upper limb hemiparesis. Now, most people here know what a stroke is, but some of you may not know how prevalent it is. And in the United States, there are approximately 800,000 people who suffer a stroke each year, and over half of these people are over 65. And about 50% of these people also suffer from some form of paresis, which is muscle weakness. Now, my goal of the research was to analyze 3 different interventions that therapists have been using to help elderly stroke victims and to determine their effectiveness based on previous studies. Now, in order to do this, I did a systematic review of the literature. In order to do that, I went on scholarly search sites such as EBSCOhost and Google Scholar and used key search terms like stroke, CVA, which is short for cerebrovascular accident, the elderly, and upper limb hemiparesis. And in order to make sure that my data was consistent, I used inclusion and exclusion criteria, including the fact that the study had to focus on an intervention that fit into one of the 3 categories that I had already chosen. The research had to be published no later than 2010, earlier than 2010, to keep the research as up to date as possible. It had to focus on the effects that the interventions had on upper limb hemiparesis and not lower limb hemiparesis or trunk weakness. And the average age of the participants of the study could be no younger than 55. Now, in order to determine the validity and clarity of each study, I used the Critical Appraisal Skills Program. And this is a chart that asks 7 questions about each of the studies, which included, are the results of the study valid? Did the authors address the questions asked? Were the controls selected in an acceptable manner? Was exposure accurately measured to minimize bias? Have confounds been accounted for? And are the results believable? And all these questions are either answered with a yes, no, or can tell. Now, if the studies didn't successfully fulfill are the results of the study valid and are the results believable, they would automatically be excluded. Now, in order to determine the effectiveness of each study, I used 2 different common studies that therapists use for elderly stroke patients. The first one is a Fugel-Meyer assessment, and that one determines how well a person has recovered after a hemiplegic stroke. And this has 113 parts to the assessment that are rated from a scale of 0 to 2. And the second one I used was the Wolf Motor Function Test, which determines the functional capability of a stroke-affected limb. And that includes 15 timed tasks and 2 strength-related tasks that are rated from a scale of 0 to 5. Now, I chose 3 different categories. I chose constraint-induced movement therapy, non-invasive electrical stimulation, and virtual reality devices. So, constraint-induced movement therapy, it's been around for a while now, but it promotes the use of the affected limb by restraining the unaffected one. The therapist will provide the patient with either a sling or a mitt, and the patient will normally have to spend a certain amount of their rehabilitation session with the mitt on and time outside of the rehabilitation session with the mitt on doing daily tasks. Now, the next one I chose was non-invasive electrical stimulation, which for the sake of my study was defined as the stimulation of the brain in stroke-affected limbs with low levels of electricity. And low levels of electricity was defined as 6 or fewer hertz of stimulation frequency in the cranium and 50 hertz of stimulation frequency on the affected area. Now, the first category that I looked at was repetitive transcranial magnetic stimulation, or RTMS. With this, a low-frequency pulses are sent through the patient's brain, and in order to send these pulses, the researcher or the therapist will place a device with an electromagnetic coil, as you see in the photos, over the part of the brain that was not affected by the stroke. Now, the next one I looked at was transcranial direct current stimulation, or TDCS. Unlike RTMS, a steady current is sent through the person's brain, and there are also it can either be anodal or cathodal. which just determines whether or not the current is going to inhibit parts of the brain or stimulate parts of the brain. And for stroke studies, anodal TDCS is the most common because it's theorized to excite parts of the brain that have already been injured from stroke. And the final one I looked at was neuromuscular electrical stimulation, and that's just a low frequency current or pulse that is sent directly to the affected limb. Now, for the sake of my research, I defined a virtual reality device as an object that uses some sort of technology to stimulate an environment that is different from this environment that the patient is currently in. The first one I looked at was virtual reality rehabilitation system. And for this one, a patient performs a basic function that's picked up by the system and projected onto the screen. Now, with this one, it has a PC workstation, a 3D motion tracking system, an LCD projector, and an LCD projector that projects the scenarios onto the screen. The motion tracking system is connected to a ball that the patient can hold on to perform the tasks given to them by a therapist who controlled the program through a PC workstation. The next one I looked at was the rehabilitation gaming system. With this one, it performs a calibration with the gloves, as you see in the picture, and it helps detect the participant's range of motion and speed, which will be used to determine the baseline difficulty for all the tasks that are assigned to them by either the researcher or the therapist. And the final one I looked at was the Rehab Master, which, unlike the other two, the entire body is tracked using a motion sensor and then projected onto the screen. The therapist calibrates the system so that the patient plays games that help them work on the skills that they are lacking in at that point in time. Now, my critique of the studies, they're very small participant sizes because most of these are pretty new technologies. There's no control group for a lot of them because you don't have enough patients to work with. And there are several of the studies that were not originally written in English, so in regards to translation, there could be some errors. Study limitations, and these are almost all these are brand new treatments. I was the only one who was conducting this study. There are very few. I only found 15 that fit my criteria. And then my official recommendation is that additional studies need to be conducted in order to generate data to analyze the effectiveness of the interventions. All of them show promise, but as of now, there's just not enough research to say for certain. So all my references.
We have about 2 minutes to ask questions of Catherine. Feel free.
Yes.
So the goal of your study was to measure the effectiveness of these 3 rehabilitation methods.
Mm-hmm.
But your sample size, as you said, for articles was limited because it's so new.
Mm-hmm.
Can you just explain why you chose to stick with the 55 and older population instead of reloading that to get more results?
I decided to do that mostly because you do to an extent just have to keep, you have to, I was trying to stay within a population. And I felt like generalizing it out to everyone would, there could be population errors. You know, younger people, they heal better than the elderly, so I wanted to look more on the elderly as opposed to everyone.